Do you wake up every night at 3 a.m. and can't fall back asleep? If you're over 60, you're not alone. In fact, over 50% of seniors struggle with this exact same problem. Tonight, I'm going to show you exactly why this happens and 7 proven ways to stop it for good. And make sure you stay until the end, because I'm going to share a surprising discovery about what your wake-up time reveals about your health. Waking up in the middle of the night is one of the most common complaints among seniors. You fall asleep just fine, but then suddenly you're wide awake at 3 a.m., staring at the ceiling, and your mind won't stop racing. Sound familiar? The frustrating part? You're exhausted the next day, but when bedtime comes again, the cycle repeats. You might feel like you're the only one dealing with this, but trust me, millions of people over 60 are going through the exact same thing right now. Let's fix this tonight. Before we dive into the solutions, let's take a moment to understand what's really happening in your body. First, let's understand why this happens. There are 5 main reasons seniors wake up at 3 a.m., and understanding these will help you fix the problem more effectively. Number 1, your sleep cycles change with age. When you were younger, you probably slept like a rock for 8 hours straight. But as we get older, our sleep architecture actually changes. We spend less time in deep sleep, which is that really restorative phase, and more time in lighter stages of sleep. Think of it like this. Young people sleep like they're in a cave, deep and undisturbed. But as we age, our sleep becomes more like a light nap, where the slightest sound or sensation can wake us up. This means you're much easier to wake up, and once you're awake, it's harder to fall back asleep. Number 2, your body produces less melatonin after 60. Melatonin is the hormone that helps you stay asleep throughout the night. It's like your body's natural sleeping pill. When you were younger, your body produced plenty of it. But after age 60, melatonin production can drop by as much as 50%. Less melatonin equals more wake-ups. It's that simple. This is why many doctors recommend melatonin supplements for older adults, though we'll talk more about supplements in just a moment. Number 3, medical conditions. This is a big one. Sleep apnea, arthritis pain, acid reflux, and prostate problems can all interrupt your sleep around this time. For men, an enlarged prostate means more trips to the bathroom. For women, hormonal changes during and after menopause can cause night sweats and hot flashes that wake you up. Arthritis pain often gets worse at night when you're lying still. And sleep apnea, where you actually stop breathing briefly during sleep, can jolt you awake without you even realizing why. If you suspect any of these conditions, it's really important to talk to your doctor. Number 4, medications. Here's something most people don't realize. Many common medications for seniors, like blood pressure pills, diuretics, which are water pills, antidepressants, and even some pain medications, can cause nighttime waking. Beta blockers, for example, can suppress melatonin production. Diuretics make you need to urinate more frequently, often waking you up at night. If you started waking up at 3 a.m. around the same time, you started a new medication. That's probably not a coincidence. Write down when you started the medication and when the sleep problems began. Then discuss it with your doctor. Often, simply changing the time you take your medication from evening to morning can solve the problem completely. And number 5, stress and worry. This one is huge. When you wake up at 3 a.m., your cortisol levels naturally spike. Cortisol is your stress hormone. It's supposed to rise in the morning to help you wake up. But when it spikes in the middle of the night, it makes your mind race. You start thinking about your health, your family, your finances, things you need to do tomorrow, or things you wish you had done differently yesterday. Once that worry cycle starts, it's almost impossible to fall back asleep. Your body is physically awake because of the cortisol, and your mind is mentally awake because of the anxiety. It's a vicious cycle. Now, here's the good news. You can break this cycle, and you don't need prescription sleeping pills to do it. Here are 7 proven strategies that actually work. These are natural, safe, and effective methods that thousands of seniors have used successfully. Solution number 1, the 3-2-1 rule. This is simple, but incredibly effective. Stop eating 3 hours before bed, stop drinking 2 hours before bed, and stop using screens 1 hour before bed. Why does this work? Let me explain each part. Your body needs time to digest food. If you eat too close to bedtime, your blood sugar spikes in the middle of the night as your body processes that food, and this spike can wake you up. Your body thinks it's time to be active because you just gave it fuel. Drinking too late means your bladder will wake you at 3 a.m. Even if you don't drink a lot, that small amount of liquid builds up over the hours, and eventually, your bladder says, "Time to wake up." And screen light from your TV, phone, or tablet suppresses your remaining melatonin production. The blue light from these screens literally tells your brain it's daytime, not nighttime. Try this tonight. Finish dinner by 6 p.m. if you go to bed at 9 p.m. Stop all liquids by 7 p.m. Turn off your TV and phone by 8 p.m. I know it sounds strict, but try it for just 3 nights and see the difference. Solution number 2, the bedroom temperature trick. Keep your bedroom cool, between 60 and 67 degrees Fahrenheit. That's about 15 to 19 degrees Celsius. Here's why this matters so much. Your body temperature naturally drops when you sleep. This drop in temperature is actually a signal to your body that it's time to sleep deeply. If your room is too warm, your body struggles to maintain the lower temperature needed for deep sleep, and you wake up around 3 a.m. when your body tries to cool down. Think of it like your body overheating and needing to wake you up to adjust. Many seniors like to keep their homes warm because they feel cold during the day. But at night, cooler is definitely better. Action step. Turn your thermostat down tonight or open a window if weather permits. Use blankets to stay warm rather than heating the whole room. Many seniors find that a cool room is the single biggest factor in sleeping through the night. Some people even use a fan, not just for the cool air, but the white noise also helps mask other sounds that might wake you. Solution number 3, don't watch the clock. When you wake up at 3 a.m., resist the urge to check the time. This is harder than it sounds. I know. Why does this matter? Looking at the clock triggers anxiety. The moment you see it's 3 a.m., your brain starts calculating. Oh no, I've only got 4 more hours until I have to wake up. Or I've been awake for 30 minutes already. I'm never going to fall back asleep. Or, this always happens. Something must be wrong with me. This anxiety floods your body with even more cortisol, making it impossible to fall back asleep. You've basically told your body there's an emergency, and your body responds by staying alert. What to do instead? Turn your clock away from the bed. If you use your phone as an alarm, put it across the room, not on your nightstand. If you wake up, keep your eyes closed, take slow, deep breaths, and don't engage with your thoughts. Don't start thinking about your day or your problems. Just focus on your breathing. Breathe in slowly for 4 counts. Hold for 4 counts. Breathe out for 4 counts. Pretend you're still asleep, and often you will drift back off within 10 to 15 minutes. Your body wants to sleep, you just have to let it. Solution number 4, the magnesium secret. This is something most doctors don't tell their patients, but it can be life-changing. Most seniors are deficient in magnesium, and low magnesium is directly linked to poor sleep. Why are seniors low in magnesium? Several reasons. First, as we age, our bodies don't absorb minerals as efficiently. Second, many medications, especially diuretics and acid reflux medications, actually deplete your magnesium levels. Third, Stress uses up magnesium. Magnesium helps relax your muscles and calm your nervous system. It's like nature's tranquilizer, but without any side effects. Studies show that taking 200 to 400 milligrams of magnesium glycinate about an hour before bed can dramatically improve sleep quality. Now, why magnesium glycinate specifically? Because it's the form that's best absorbed and least likely to cause digestive upset. Other forms, like magnesium oxide, can cause diarrhea, which is definitely an absolute game changer. I've heard from countless people who say magnesium fixed their sleep problems when nothing else worked. Solution number 5, the worry list technique. If your mind races at 3 a.m. with worries and to-do lists, try this simple trick. Keep a notepad and pen by your bed. Not your phone, an actual notepad. When you wake up worrying, turn on a very dim light, just enough to see, and write down whatever is on your mind. Don't write essays, just bullet points. Mom's doctor appointment, call bank about statement, pick up prescription, whatever it is. This does 2 powerful things. First, it gets the thoughts out of your head and onto paper so your brain can stop trying to remember them. Your brain's job is to remember important things, and it will keep you awake trying to hold on to these thoughts. When you write them down, you're telling your brain, "It's okay. I've got this recorded. You can relax now." Second, it signals to your subconscious that you'll deal with these concerns tomorrow, not now. You're essentially making a deal with your worried mind. I acknowledge you. I've written this down, but right now is not the time to solve it. Many people find that just writing 3 or 4 sentences allows them to fall back asleep within minutes. The key is to keep it brief. Don't start journaling or problem solving, just capture the thought and put the pen down. Solution number 6, rethink your evening beverage. Are you having wine or alcohol in the evening to help you relax? Here's something important to know that might surprise you. While alcohol might help you fall asleep initially, it severely disrupts your sleep cycles 3 to 4 hours later. That's right, a glass of wine at 7 p.m. can cause you to wake up around midnight or 3 a.m. as your body processes the alcohol and goes through withdrawal. Yes, even from one glass, your body goes through a mini withdrawal. Alcohol also suppresses REM sleep, which is the restorative sleep phase where your brain processes memories and emotions. So even if you sleep through the night with alcohol, you're not getting quality sleep. Consider cutting out alcohol entirely for 2 weeks and see if your sleep improves. Many seniors report this single change eliminates their 3 a.m. wake-ups completely. And it's not just about sleep. Reducing alcohol has so many other health benefits too. If you're drinking coffee or tea after 2 p.m., that could also be the culprit. Caffeine has a half-life of 5 to 6 hours, meaning it's still affecting your system late into the night. If you have coffee at 4 p.m., half of that caffeine is still in your system at 10 p.m. Try switching to decaf after lunch, or better yet, stop all caffeine by noon. Some people are very sensitive to caffeine and need to stop even earlier. Pay attention to your body and adjust accordingly. Solution number 7, the 20-minute rule. This is crucial, and it might be the most important tip I give you today. If you can't fall back asleep after 20 minutes, get out of bed. I know this sounds counterintuitive. You're thinking, but I'm tired. I should stay in bed and rest. But here's why this is so important. Lying in bed awake trains your brain to associate your bed with being awake, not sleeping. This makes the problem worse over time. Sleep researchers call this conditioned arousal. Your brain starts to think, oh, we're in bed, time to be awake and worry about things. You're literally training yourself to have insomnia. Instead, get up and do something boring in dim light. Read a paper book, Not on a screen fold laundry. Do a simple puzzle. Sit quietly in a chair. No screens, no bright lights, no snacking. Just something calm and monotonous. The key is to do something that's slightly boring, not stimulating. Don't start cleaning your whole house or watching an exciting movie. You want to be calm but awake until you feel sleepy again. When you feel your eyelids getting heavy, when you start yawning, that's your signal. Go back to bed. This retrains your brain to see your bed as a place for sleep only, not for worrying or being awake. It might take a few nights, but this technique is incredibly effective. Here's a bonus tip that many people don't know, and this is really fascinating. The time you wake up might give you a clue about the cause. Traditional Chinese medicine has studied this for thousands of years, and modern science is starting to back some of it up. If you wake between 1 and 3 a.m., it could be related to liver function or blood sugar issues. Your liver is doing a lot of detoxification work during this time, and if it's overloaded, it can wake you up. This might mean you're eating too much sugar or drinking too much alcohol. If you wake between 3 and 5 a.m., it's often linked to low oxygen levels or breathing problems like sleep apnea. It can also be related to lung function and grief or sadness in Chinese medicine. If you consistently wake at the same time every night for weeks, talk to your doctor. There might be an underlying medical issue that needs attention. Don't ignore patterns. Also, consider keeping a simple sleep diary for 1 week. Get a notebook and every morning write down what time you went to bed, what time you woke up in the middle of the night, what you ate for dinner, what time you ate, any alcohol or caffeine you had, what medications you took and when, your stress level that day, and how you felt the next morning. Patterns often emerge that point to the exact cause. You might notice that every time you eat late, you wake up. Or every time you have wine, you wake up at 3 a.m. This information is gold, and it makes you a detective of your own health. So here's your action plan for tonight. I want you to pick 3 of these strategies and commit to trying them for the next 7 days. 1. Implement the 3-2-1 rule. No food after 6 p.m., no drinks after 7 p.m., no screens after 8 p.m. 2. Make your bedroom cool. Aim for 65 degrees Fahrenheit. 3. Turn your clock away from the bed so you can't see the time if you wake up. 4. Consider magnesium, but check with your doctor first to make sure it's safe for you. 5. Keep a notepad by your bed for midnight worries. 6. Cut out alcohol and limit caffeine to before noon. 7. Use the 20-minute rule. If you can't sleep after 20 minutes, get up. Try at least 3 of these things starting tonight, and I'm confident you'll see improvement within just a few days. Most people notice a difference the very first night, especially with the temperature change and the 3-2-1 rule. Now, I want to hear from you. What time do you usually wake up at night? Is it always the same time, or does it vary? And which of these 7 strategies are you going to try first? Drop a comment below and let me know. I read every single comment, and I love hearing your experiences. Sometimes the best tips come from the community, from people sharing what worked for them. So don't be shy. Leave a comment. Let's help each other out. If this video was helpful to you, and I really hope it was, please hit that like button. It helps more people find this information. And if you haven't already, subscribe to the channel and click the bell icon so you don't miss future videos. I post new senior health tips every week, covering everything from nutrition to exercise to sleep to brain health. Next week, I'm going to talk about natural remedies for joint pain, which is another huge issue for seniors. You won't want to miss that one. And remember, better sleep is possible at any age. You deserve to wake up feeling rested and refreshed, not exhausted and frustrated. Sleep problems are not just a normal part of aging that you have to accept. They can be fixed. With the right strategies and a little patience, you can train your body to sleep through the night again. Sweet dreams, and I'll see you in the next video.